Thanks.
You can use it. So please, first of all, let's check the technical issues. If you can hear translation from English into Ukrainian. Нікому не потрібен на українську мову переклад, всі розуміють. Добре, тоді давайте перевіримо, чи є переклад з України.
Then let's see if the English interpretation is coming through. Can you copy me? Great. So this was the first housekeeping announcement I should have made. We'll be working for probably 50 minutes and then continue with some networking, informal communication. So once again, thanks for coming. Happy to see you. I'm Oksana Kyrychok, Program Director, 100% Life Charity. We have invited you on a very important occasion because we're supposed to somehow summarize what we've achieved in the past almost 5 years in ASSESS Pro, an important undertaking that was intended to change the response to HIV/AIDS epidemics in Ukraine. So once again, thanks for coming. With this, over to Dmytro Sherembey. Thanks. Let me say thank you to PEPFAR and CDC in Ukraine, Zach, Laura, because the outcomes of the project have a number of important components. My personal data, a person living with HIV, are now protected. Another 124,220 medical cards. 30 labs in Ukraine work according to standards. 507 clinical units. So any person who goes there knows that their personal data are adequately protected, and this helps do proper testing, treatment, you name it. Medical card, official government medical card was made thanks to this project, and currently it is a very good example for everyone to follow, because it's not just about upgrading, modernizing the system. No, it's human rights respect for human dignity, the right to be protected. It's part of our safety and security, and in a civilized country, healthcare should always meet the standards. Thanks to our project, we made a breakthrough. I'm very happy to have partners that we have who have stood by us after the full-scale invasion. They've been in touch with us on every single day, and this partnership helped the entire treatment system at the time of war. It helped support 24/7 our hotline, despite the shelling and missile attacks. This partnership helped us retain all the programs. So thank you very much once again. Clearly, we couldn't invite everyone living with HIV/AIDS in Ukraine, but in their behalf, I do appreciate your support, your assistance. We'll be working towards achieving new goals, new results. The therapy is available, all systems are working, and that helped us survive. If embassies decided to leave Ukraine tomorrow, the systems would stay, and this is very important. Thank you. Thank you, Dmytro. The systems created, implemented is key to protecting personal data of persons living with HIV/AIDS. Laura, press the button, please.
So much for having me and my colleagues, and I'm listening to myself in my ear, so that's new. I'm really happy to be here with you to celebrate this achievement, and as far as I know, we're not going anywhere tomorrow, but we definitely appreciate the sustainability of this program. Thanks so much.
Дякую вам дуже. Програма PEPFAR нас підтримала.
PEPFAR supported, financed us, but our daily effort wouldn't have been possible without CDC office in Ukraine. Ezra Barzilai, thank you for having stayed with us, for having stayed by us, for having accepted our challenges, difficulties, and supported our successes. I too am very happy to be here today with you, and happy to kick off this meeting dedicated to the achievements of ASSESS Pro. Well, indeed, IS on socially significant diseases and laboratory systems, over 600,000 medical records maintained at 700 plus healthcare institutions. The systems are in trusted words. Equipment, computer, quality data, analytical work, and personnel training. And let me also mention that our information management system at the time war has become a critical element of the system, because Russians destroyed paper documents, but systems kept going and helped provide treatment to the vulnerables. I would also like to say to all the professionals who stayed by us, as they say, when one door closes, another one opens up, and I am sure that we'll be working with key stakeholders and groups, providing even greater support to HIV positive persons. Thanks for your cooperation towards our joint victory. Indeed, Ezra was right. This project dedicated to information system is coming to a close, but PEPFAR is here, CDC is here, and starting October this year, we are launching a new project dedicated to supporting the communities and vulnerable groups. Now, I will invite our Ukrainian partners, because after all, what we've been doing, we have been doing in coordination with them. Mr. Kurdus, Deputy Director General of Public Health Center. Today I am head of the IT department, and let me say that the most important messages have already been offered today. Like Dmytro, I am very happy that we managed to keep going even at the most critical moments. We worked on the 24th of February, on the 25th, and on and on and on. ASSESS Pro was rolling out during COVID and war, and it showed that it is very sustainable because we worked like a team. The system is is an ecosystem with mobile app, laboratory information system, and I would also like to express our gratitude to all donors and friends. 100% Life are our partners who we hope to be working in the future. Thank you very much. Thank you, Oleksandr. Oleksandr mentioned that we started as a dedicated system, but as the e-health and public health centers were developing, we were incorporated in a national system. Unfortunately, Dmytro, where are you? Oh, he's sitting opposite me and I failed to notice him. So, Dmytro, could you say a few words as a representative of the National Health Service? I too am very happy to be with you today, dear colleagues and friends. It's a great pleasure to work with trusted partners. It inspires all of us. It is a guarantee of successes. Our interaction with the project helped, eHealth Ukraine to incorporate one of the greatest values we abide by. We integrated persons living with HIV/AIDS in the national system of medical records, and we have done it in a way that information is protected, non-transferable without consent. It was very important that the project helped us develop relevant functionalities. It's called sensitive module, very good designation, I'd say. At the time when medical guarantees program was rolling out in Ukraine, it was important for us to see that all patients, including persons with HIV plus, have access to services. To this end, their data had to be adequately protected. It's so sensitive module has since been in existence. We improved it, and we hope that we'll be able to improve it even more if need be. With your assistance, I too rely on you, on your goodwill in cooperating with us. We are open to a dialogue, and we'd be adding additional functionality to e-health in Ukraine. Thank you very much. Thank you. We have a range of partners around this table, so we decided to make some key, findings, if I may say so, to show you the picture we now have after 5 years of its implementation. You'll be the name of the project, the title of the project is what we've succeeded in implementing. Access to services via information systems. That is to say, I hope that we have successfully integrated national level databases and patients, clients. We have always strived for client-centeredness. The goal of the project was to improve medical care to people living with HIV through innovative services. One of the key objectives was to modernize the system that at the time of our commencement was managed by the Center of Public Health, but clearly needed some improvement in order to extend to other categories, not just HIV. Therefore, we worked on some new modules on developing the implementation of a strategy. We also wanted to help providers improve their services, the delivery thereof, and another important objective was to help the Center of Public Health of the Ministry of Health of Ukraine. At the time, they were building their capacity, into really helping them feel ownership of the system 100%. So the main results as far as the information system is concerned are as follows. Initially it was HIV in Ukraine, but eventually it turned into socially significant diseases information system. Along the way, we integrated the system with ASSESS, developed several specific modules: substitution therapy, hepatitis, vertical transmission, logistics, and data quality assessment. In other words, the system received a number of elements that helps currently the Public Health Center receive data to inform their qualitative care efforts. A couple of figures about the system, its key components: HIV, 544 institutions, 866 members of staff, patients with the status, 226,000 are registered in the system. Practically all HIV positive, whether they are on ART or not, their data, medical data, are in the system. Also, as the TB module was developed, services provided to TB patients were added. 83 institutions are currently available. An important consideration: data collection using TB patient medical card didn't have to start from scratch. Almost 500 medical cards could be and were incorporated, imported, so to speak, into the system. It was mentioned that we did a module on the substitution support therapy. 278 institutions joined it. Almost 34 episodes of substitution therapy treatment were included in the system. Logistics is also a very important element of the system because it helps monitor at various levels availability of meds needed by clients. 99% of institutions emphasize work with this logistics module that helps them track the movement on meds, that helps them do advance orders in order to provide for continuity of treatment. Well, now on the potentialities of the system. First of all, it helps do reports, national reports, both in ISU and PEPFAR. Analytical modules were provided. Dashboards have been created that help inform management decisions. Also, the system helps better assess the quality of data put in the system. in their improvement. I already mentioned that lab information system was an important goal we wanted to achieve. As we started the project, we could see full well that manual input of data can lead to deteriorated quality. Therefore, we decided right away to do that automatically. This map shows you the map of labs, both HIV diagnostics and TB diagnostics, that have the system deployed, and this information is integrated with medical cards of patients. 3 labs belong in this network of public health center. As of today, more than almost 500,000 requests are incorporated. 31 labs are working within the system, and accordingly 402 lab professionals are users of the system. An additional but very important component of the system is lab accreditation support according to the state standards 119, 159. Cherkasy Public Health Center and Kryvyi Rih Center have successfully gotten their accreditations. That said, we worked extensively with the Center of Public Health on implementation of personal data encoding or encryption system to support trans-border data exchange. Over 3,000 codes were translated, guidelines were developed, management models, and all these elements are now integrated with our laboratory information system. In other words, the data there are coded according to international standards, and data exchange can now be accomplished both inside the country and trans-border. Well, not only we try to improve the system, but also the capacity, to build capacity of those who work with us. Trainings were carried out, special tools for data analytics were also developed. Long-standing effort aimed at improving data quality brought its fruit. Data quality is assessed regularly at the sites, 96%, even more than that, of data are trustworthy, realistic, and are true to life, as it were. Dmytro from the National Health Service mentioned that we wanted to protect personal data of vulnerable clients with HIV, so data protection was part of electronic health system. It streamlined and simplified access to data, and at the same time offered additional protection to client personal data. We developed a new documentation for the functions added to the system according to the contract negotiated earlier. Now the system is owned by the National Health System. Interaction with e-health was also very fruitful through the entire cycle of the project. The public health service learned how to incorporate Dmytro system. A test environment was created, a concept of interaction of the SSDIS and e-health system for bilateral data exchange. Technical description of the system was completed, and tests were run that helped identify some errors with a view to their ultimate elimination. The Center of Public Health is working on some of the issues so that next year they can pilot protected data exchange in real time. As I've mentioned, working with the system will never forgotten about the best interest of the patients. This year we improved client and app. Currently, a patient can use their devices, gadgets, to access their medical records. So if they move inside or outside of Ukraine, they can individually track their progress and therefore support their adherence. Patients see the outcomes of treatment, all indications made by the doctor, all treatment modalities. They can use special reminders to not skip some medications. This application also helps verify the user using some biometrics, and the encryption protocol makes sure that client personal data are adequately protected. Generally, the app helps improve the efficacy of the patient's treatment. It's a novel product, therefore we designed and implemented a communication campaign in order to disseminate information both among professionals and clients about this mobile application in order to enlist as many users as we could. Over 3,000 have already downloaded and installed and are using this application, but we are still working in this communication campaign in order to grow the numbers of users. That's the last but probably the most important slide, because it relates to client-centeredness nature of the project. It illustrates how we worked with the HIV/AIDS hotline. The hotline stood the test of the wartime and helped patients deal with the challenges they faced on a daily basis. We focus not only on consulting ART adherence. We processed over 5,600 requests on PrEP, on partner involvement, and we also provided legal advice and client support, psychosocial support, and other things that help clients overcome any barriers they may have had to negotiate in gaining daily access to treatment. This is a thank you slide referring to our donors, our partners, and of course we couldn't show here all the institutions we've been working with and organizations in the private sector or social society. Thank you very much for your attention during my brief review of the outcomes of the project. With this, if I may, I would like to try and encourage some sort of a discussion of this report. Should you have any comments, any questions, because I see guys representing close Deloitte use this chance to engage in a discussion. So impressed you must be that are reluctant to ask any questions. Okay. In the meantime, we have our colleagues from the hotline. I said something about our interaction with the patients. Could you please share how you managed to retain patients thanks to the project? Thank you very much for the invitation. We are, so to speak, those who try connect clients with medical healthcare services. Ours was the task of properly inform clients calling us. All the calls have been made by motivated clients who sought information, qualitative information. It's not so much about the figures, because every call is a personal story. Clients who called us not always knew everything about the system, so when we informed them about that, they were impressed at the qualitative services provided locally in the community. I don't like the word complaints, rather they are barriers that our clients sought to overcome, and we did our best to help them do that. Looking at the dynamics, the situation has indeed improved. The attitude of medical professionals to clients has improved, and all the four barriers I could recall now stemmed from some sort of a miscommunication between doctors and clients. The system worked fine, so it's interpersonal thing, you know. And there was another important component I want to specifically mention it, psychological support. It is the mental health of our clients has naturally deteriorated at the time of war, and the psychological support thing helped our HIV positive clients get help in GBV situations. Well, every story, like I say, has its facets and shows that we are trying to leave no one behind from among our clients, our callers, so to speak. Once again, I would like to thank all our partners for helping us all along. We in turn provided feedback, so to speak, that was very instrumental in carrying this project on. Thanks very much for your cooperation, and let's be together, let's work together in the future. Discussing further I'll probably ask Serhiy or Oleksandr about that mobile application. Was that an important endeavor? Well, we have our own hotline. I mean, the Center of Public Health does 100,000 calls are processed. It shows that the system is alive and kicking. And I can say that the system is a living, so to speak, thing. It also helps us see where we're heading. For us, the government sustainability comes first. The fact that the system has been in operation for quite some time is a very good sign of credibility of the system with our clients. Speaking of the ecosystem, yes, we would like to be helpful to our doctors, medical professionals. They are our primary users, but we also want to help clients. So development of this client-oriented mobile application is more than welcome. In one of the slides, you mentioned dashboards. An important step indeed to popularize data on socially significant diseases at the national level, because not everyone knows or interested in that unless he is confronted with it directly. The system is using a big database, so it can really be used for research purposes, informing some analytical work regarding the dynamics of epidemics in question. So it would be good if we can do that. Thank you. Oleksandr, are you ready for your comment? Microphone, будь ласка. Microphone, будь ласка. Microphone. Yeah, good. I'm Oleksandr Deha on CDC, and I was coordinating this project for many years. Well, in fact, the second phase of the project is coming to a close. It started as ASSESS Pro almost 12 years ago. At the time, we started this project with a very good team. Several attempts have been made in the country to come up with a system like that. Unfortunately, too little, if any, avail. It was difficult to blaze the trail. The most important part was not so much about developing the system, but implementing it, showing people how they can use it, build trust amongst healthcare institutions, so they would not, so to speak, drop out of the system, but continue populating it with important data. This took a lot of effort of every member of the team and our partners. Of course, the Center of Public Health need to be mentioned amongst the first of our partners. Otherwise, the system has a big potential, which is yet to be explored, and speaking of SSD, it was just a dream to have client data receiving assistance in HIV and TB, integrated within one system. And data quality, Oksana mentioned them in their report, is as things stand, very impressive. We can rely on this data and we can safely analyze them. A lot of work is ahead of us. Substitution therapy module mentioned earlier is something that not every healthcare institution using at the moment. But let me reassure you that we're going to be standing by our partners, such as 100% Life and our public health partners, Ministry of Health, public health centers. We will do our best effort to support the national health system and e-health system. Within the framework of the forthcoming project, a lot of focus is going to be on standardization of medical information and structuring this information in an integrated system, building a strategy for further development of e-health system nationwide. That's right. Thanks very much for your recognition. By the way, it just occurred to me that we thanked our donors, our stakeholders, but sitting in front of me is the members of the project team, and let me recognize their contribution. In particular, thank you, dear colleagues. Every day, close to close of business, we would sit and share. You were those who acted within this project in a very humane manner. You were very flexible, you were very tolerant and patient, and that helped almost every hospital adopt the system. I recall our progress report to CDC. So it was daily hard work that is the guarantee of success, guarantee of sustainability. Every step we made was made for the benefit in the interest of our patients and clients. So we are working as the charity 100% Life organization to make sure that everyone in this country is happy with their health. So once again, thank you, guys from PR, from financial department, because you all helped us so that we can perform working in a fair and efficacious manner, meeting the requirements of PEPFAR, and thank you. Well, unless there are any comments, I've a couple of questions. I am a new kid on the block, so can say that I'm very much knowledgeable about the system, but I am impressed at what I just heard, the report you made. So as that new kid on the block, let me ask you this. do I say that this system is already a national system or just one of the systems that are used in the health sector to, well, provide services to persons with HIV AIDS? Could you introduce yourself, sir? HRS, Health Reform Support Project, another USAID project. In my project, in our project, I'm in charge of e-health component and cybersecurity. This is, and I've got a couple of questions I'll make in a while. I'll try to be brief in responding to your query. As of today, the ISSSD is a national system to the extent that it helps track patients and medications. Well, on the other hand, as far there are no limitations on maintaining the records and reports, but strategically we'd certainly be happy to have a more analytical system rather than logistical, but this is a strategic interest. But to answer your question once again, I'd say it's a national system. Looking at the stats, I know that 500 institutions are already using to work with HIV patients, 200 TB, but this is certainly not all the institutions working with this category of clients in Ukraine. What are the impediments, the barriers standing in the way of a more dynamic, rapid expansion of the system? Well, every question of yours tends to be more and more sophisticated, complicated. Well, as far as the resources are concerned, no barriers. Technically, the system can scale to serve, twice as many, 10 times as many clients, but what is the system? It's a tool to help institutions report on medical packages and claim compensations. Thanks to partners and donors, the system can be used free of charge, but this we are therefore staying away from general outpatient and limit ourselves to only socially significant. Well, every institution is free to decide whether this tool would come in handy for other purposes. So no technical barriers. Politically, we are staying away from general health care. And yes, one other important thing, we only service general civilian population. Thank you. And this is my last question, probably even more complicated, at least it may appear to be such. You mentioned personnel data on many occasions, adequate, reliable protection. What makes it so adequate and reliable? Is it verifiable, so to speak, the level of protection? Oh, that's a good question. I like it. Indeed, the system operates on both personal and operational data. Mental health and HIV are pretty strongly regulated, so protection of this data is a priority. The system is certified by the state Information and Communication Special Communication Center. Basically, all data are encrypted. Decryption of this data will use so much resources that the entire effort should be, regarded as inexpedient. And we also use qualified electronic digital signatures of every so only users reporting to e-health use those qualified digital signatures. That's probably what I can say. I won't talk about roles, policies and boundaries in the system. This would be too technical. Thank you for the questions and for clear answers. In fact, it's good to know that Public Health Center is not just assuming ownership of the system, but making promises for its future improvement. Personal data have always been important, and I'm happy to hear that they will be standing by it. Unless there are any comments, I'd like to submit that we have, basically exhausted the formal part of our agenda and may therefore enjoy some informal interpersonal communication. Coffee, well, you know where it is. We can't enjoy it here. So thanks a bunch and invite you to take part in this informal communication. So 100% live is with you and it keeps going.